Chapter 8, Evaluation and Management, Part 1. Evaluation and Management. This section contains services that are commonly associated with doctor visits. This includes the history, the exam, and medical decision making. Codes are divided into categories and subcategories. Categories are based on the setting in which the service was provided. Was the service provided in the hospital? Was it in a doctor's office? In a nursing home? So where were the services provided? Subcategories divide into new versus established patient. A new patient is a patient that has not been seen by the practice within the last 3 years. So if they've been there within the last 3 years, they are an established patient. If it's been more than 3 years, they would be considered a new patient again. Initial or subsequent visit. Is this the first time they were seen in the hospital? Is it day 2, day 3 of their stay? And the patient's age. In this chapter, there's a lot of key terms that will help your understanding. Again, a new patient is a patient that has not been seen by a particular physician or another physician of the same specialty within the same group practice during the previous 3 years. An established patient has been seen by a particular physician or another physician of the same specialty within the same group practice during the past 3 years. Chief complaint is a brief statement, usually in the patient's own words, that describes the reason the patient is being seen by the physician. Concurrent care is when 2 or more physicians provide care to the same patient on the same day. Transfer of care is when one physician who is managing all or some of the patient's medical condition gives that care to another physician who agrees to accept responsibility for providing care for those conditions. Counseling it's a discussion with a patient or a family regarding aspects of a patient's medical situation. Family history is a review of the medical histories of family members. It could be parents, siblings, children. Nature of presenting problems. There's 5 types. You have minimal, self-limited or minor, low severity, moderate severity, or high severity. Past history includes major illnesses, injuries, operations, hospitalizations, medications, allergies, immunizations, and dietary status. Review of systems. This is a series of questions regarding the body and organs. It's designed to help identify signs and symptoms that a patient is experiencing or has experienced. Physical examination. This is a process by which the physician or other healthcare provider assesses a patient for the presence or extent of an illness or injury. Medical decision making involves consideration of all available information, including history, physical exam, diagnostic laboratory test, imaging studies, and other individualized information regarding the patient to determine possible diagnosis and treatment options for the patient's medical condition. Your social history is a review of the patient's non-medical information. This might include drinking, smoking. Time is an explicit component of most E&M services. It specifies an average time associated with that service. Unlisted services, E&M, services that are not identified by a specific CPT code. Special report may be used to demonstrate the medical appropriateness of an evaluation and management service. There are different levels of evaluation and management services, so make sure you're paying close attention to the descriptors. These descriptors can include up to 7 components, but the most common components are going to be your history, your physical exam, and your medical decision making. These 3 components are often referred to as your key components. Counseling, coordination, and care, coordination of care, and nature of presenting problems. These 3 components are referred to as contributory components. And time is another component. When working with histories, you're going to have 4 different types of histories. Problem-focused, expanded problem-focused, detailed, and comprehensive. A problem-focused history contains a chief complaint, a brief history of present illness. Your expanded problem-focused history has a chief complaint, a brief history of present illness, a review of systems that are pertinent to the problem. A detailed history will include a chief complaint, an extended HPI, extended ROS or review of systems, including pertinent systems and a limited number of additional systems. Pertinent past, family, and social histories that are directly related to the patient's problems. And a comprehensive history is an extremely complete history that includes your chief complaint, an extended HPI, a complete ROS related to the problem identified in the history of the present illness, plus a review of all additional systems, a complete past, family, and social history. There are many elements involved in a history. Refer to Table 8.1 on page 196. You'll have a review of systems. A problem pertinence review addresses the system directly related to the problem that is identified in the chief complaint or the HPI. Usually only one system is addressed with a problem pertinent review. An extended ROS includes inquiries about systems directly related to the problem identified in the HPI and a limited number of additional systems. Usually 2 to 9 additional systems are addressed and documented. A complete ROS addresses the system directly related to the problem identified in the HPI, plus all other systems. 10 or more systems are usually addressed and documented for a complete ROS. Another element is the past, family, and social histories. This includes information regarding the patient's past family and social history and is a factor of the E&M coding. Physical exam. There are 4 types of physical exams. The 4 types are based on the number of the body areas or organ systems examined or the extent of the exam of a single body area or organ system. A problem-focused exam consists of a limited exam of the affected body area or organ system. An expanded problem-focused exam has a limited exam of the affected body areas or organ systems and other related systems. A detailed exam includes extended exam of the affected body areas or organ system and other related systems. And other related systems. Comprehensive exams include general, multi-system exams, or a complete exam of a single body area or organ system. This usually includes documentation regarding findings from at least 8 of the 12 organ systems. Medical decision making is an extremely big factor when it comes to picking your evaluation and management code. It is probably one of the more difficult elements, but there is 4 different types of medical decision making: straightforward, low complexity, moderate complexity, and high complexity. You may want to refer to the table to table 8.2 on page 199. The elements of medical decision making: you're going to need to know the number of possible diagnosis or treatment options to be considered, the amount of complexity of the medical records, the diagnostic test, and other information that must be reviewed and analyzed, and the risk of complications. This includes morbidity, mortality, or comorbidities associated with the patient's chief complaint, diagnostic test, and or other treatment options. Selecting the correct level of E&M service. When trying to select the correct level, you need to ask yourself a few questions. Is this patient a new or an established patient? Where did these services occur? And does the use of this code require 2 or more key elements?